Hello, my presentation is going to be on child life therapy, also known as play therapy. So to introduce child life therapy is a specialized field within pediatric healthcare. It focuses on supporting children's emotional, psychological, and developmental needs during medical experiences. It's rooted in theories of play, child development, psychosocial care. Child life therapy recognizes play as a central mechanism through which children process experiences, reduce anxiety, and regain a sense of control. The role of a child life specialist involves preparing children for medical procedures, offering coping strategies, and easing therapeutic play that aligns with developmental stages. As seen in clinical environments such as Niswonger Children's Hospital, child life specialists integrate play into daily routines to create a sense of safety and connection. Modern play therapy draws heavily from psychoanalytic foundations, such as the work of Anna Freud and Melanie Klein, who emphasize the psychological meaning behind children's play and its role in emotional expression. Over time, research has continued to confirm play therapy's effectiveness in reducing stress, improving resilience, and enhancing coping in hospitalized or medically vulnerable children. This presentation will explore the historical, theoretical, and contemporary evidence supporting child life therapy, including its applications, developmental relevance, and outcomes across diverse healthcare and educational settings. The origins of therapeutic play can be traced to early psychoanalytic work with children, particularly the influence of Anna Freud and Melanie Klein. Exhibitions from the Freud Museum London highlight the long-standing relationship between psychoanalysis, play, and child development. The Freud Tiffany and the Best Possible School exhibition illustrates how early 20th century educators and psychoanalysts viewed play not simply as recreational, but as a critical pathway for emotional development and psychological expression. Melanie Klein's The Psychoanalysis of Children in 1932 introduced play as an analog to adult-free association, arguing that children express unconscious conflicts symbolically through play. Anna Freud expanded this understanding by emphasizing developmental perspectives and the supportive role of the therapeutic relationship. Historical analysis, such as those by Anderson and Burlingham, showed how psychoanalytic thinkers collaborated with educators to create play-centered learning environments that aimed to nurture emotional well-being. At the same time, wartime correspondence documented by Demoucy reveals how Anna Freud applied play-based and emotionally supportive interventions for children experiencing trauma. These historical foundations laid essential groundwork for contemporary child life therapy, which continues to integrate play as a method of communication, coping, and psychological healing for children facing stressful experiences. Psychoanalysis played a central role in founding play as a therapeutic intervention. Melanie Klein's pioneering work treated play as a direct window into the child's inner world. In The Psychoanalysis of Children, Klein asserted that children use play symbolically to express unconscious anxieties, desires, and conflicts, allowing therapists to interpret themes and offer emotional insight. Her approach greatly influenced modern expressive therapies by confirming play as a legitimate mode of psychological communication. Meanwhile, Anna Freud emphasized the importance of developmental stages in ego functioning. She believed that therapeutic play must consider the child's cognitive and emotional capacities, ensuring support rather than solely interpretation. Anna Freud's work during World War II with displaced children proved the importance of emotional attunement, routine, and supportive environments in mitigating trauma. Research on correspondence between children and Eleanor Roosevelt highlights how Freud's interventions recognized emotional expression as essential for resilience. The Psychoanalytic Museum exhibitions further showed how both theorists promoted environments where play fostered safety and self-expression. Their collective work set up foundational principles, symbolic expressions, therapeutic relationship quality, and developmental sensitivity that continue to guide child life specialists and contemporary play therapists. Play has long been considered a powerful mechanism for understanding children's emotional experiences within psychoanalytic theory. The Freud Museum London's exhibition on play and psychoanalysis emphasizes that play is not merely recreational, but serves as a structured means for children to process internal conflicts. Early psychoanalysts recognized that children naturally express fears, desires, and relational dynamics through symbolic play scenarios, often revealing unconscious material that cannot yet be articulated verbally. Klein used small toys to observe how children externalized internal anxieties, while Anna Freud viewed play more as a supportive medium that strengthened ego functioning. In both perspectives, play becomes a safe space where children can reenact troubling experiences, negotiate power or control, and receive therapeutic containment. The museum's historical displays show how play materials evolved to help expression in tailored, developmentally appropriate ways. Modern therapeutic approaches still rely on this legacy, incorporating play-based techniques for assessing emotional states, reducing distress, and promoting coping. The psychoanalytic understanding of play proved the conceptual basis for integrating therapeutic play in hospitals, schools, and trauma-informed settings, highlighting its lasting influence on child life therapy today. Cognitive development is a crucial factor in designing effective play therapy interventions. As outlined by Malik and Marwa, children progress through stages marked by increasing complexity in memory, reasoning, symbolic thought, and problem-solving abilities. These developmental capacities directly influence how children engage in play and how they process stressful or unfamiliar experiences such as hospitalization. Young children rely more heavily on sensory exploration and simple, imaginative scenarios, while older children can engage in rule-governed activities and more advanced symbolic play. Understanding cognitive development allows child life specialists to tailor interventions, such as medical play, mock procedures, or storytelling, to a child's developmental level. Developmentally appropriate play helps children predict events, understand sequences, and mentally rehearse coping strategies. This reduces fear, normalizes the medical environment, and reinforces mastery. Cognitive development also interacts with emotional and psychosocial development. Therefore, play therapy must match both cognitive abilities and therapeutic goals. By grounding interventions in developmental science, Child life specialists help children make sense of complex medical information, support autonomy, and enhance coping through guided, structured play that aligns with cognitive readiness and comprehension. Erikson's stages of psychosocial development provide a valuable framework for understanding children's emotional and social needs in therapeutic settings. According to Ornstein and Lewis, each stage presents a central conflict that shapes identity and coping abilities. For example, young children in the initiative versus guilt stage need opportunities for imaginative play and autonomy, while school-age children in the industry versus inferiority stage benefit from activities that reinforce competence. Play therapy naturally supports these psychosocial needs by giving children spaces to explore independence, mastery, and emotional regulation. In healthcare environments, medical experiences can challenge children's sense of control and self-efficacy, making therapeutic play especially important. Child life specialists draw upon psychosocial principles to design interventions that confirm feelings, build confidence, and support developmental progression despite illness or hospitalization. Procedures such as medical play, role reversal activities, and collaborative games help children work through fears and develop resilience. Erikson's theory underscores the importance of supporting identity formation and emotional growth at every stage, positioning play as a crucial medium for nurturing healthy psychosocial outcomes during stressful life events. Humanistic psychology contributes a strong philosophical foundation for child-centered play therapy, emphasizing empathy, unconditional positive regard, and the intrinsic capacity for growth. According to Psychology Writing's discussion on humanistic theory in real-world settings, humanistic approaches prioritize authentic relationships and supportive environments that foster self-actualization. Child-centered play therapy, influenced by Carl Rogers and later developed by figures such as Virginia Axline, adopts these principles by allowing children to lead play experiences in a non-judgmental space. This empowers children to explore feelings, solve problems, and develop self-confidence. The Right Choice Recovery editorial team's resource on person-centered therapy highlights the broader importance of respecting the client's subjective experience and fostering autonomy. Principles easily adapted to pediatric contexts. Empathetic attunement and reflective communication help children feel understood, promoting trust and emotional safety. Humanistic values also align with child life practice by encouraging collaboration, choice, and respect for the child's voice during medical experiences. When combined with structured therapeutic play, person-centered approaches enhance emotional resilience and support healing by acknowledging each child's individual experience. Child-centered play therapy, CCPT, emerged from the humanistic framework and emphasizes the child's autonomy with the therapeutic process. According to Wise and Vincent, CCPT was developed by Virginia Axline, who expanded Carl Rogers' person-centered principles into child play settings. The approach is grounded in respect, empathy, and belief in the child's capacity for self-directed healing. In CCPT, the therapist provides a safe, accepting environment where the child chooses the play materials, themes, and pace of the interaction. The therapist reflects emotions, sets consistent boundaries, and offers supportive presence without directing the child's choices. This structure encourages children to express feelings, work through conflicts, and develop self-regulation. CCPT is especially valuable for children experiencing medical stress, trauma, or anxiety, as it reinstates a sense of control often diminished in healthcare settings. Unlike more interpretive psychoanalytic approaches, CCPT focuses less on analyzing symbolism and more on empowering children's internal coping resources. Research and clinical practice consistently show that CCPT enhances emotional resilience, confidence, and behavioral adaptation, making it one of the most influential therapeutic models within child life services. Research strongly supports play therapy as an effective intervention for hospitalized children. The systematic review by Godino, Inez, and colleagues synthesizes evidence on various play-based approaches used in medical environments. Findings show that therapeutic play significantly reduces anxiety, improves adaptation to hospitalization, enhances emotional expression, and promotes cooperation during medical procedures. Medical play, such as using dolls or medical kits, helps children rehearse procedures, correct misconceptions, and regain a sense of control. Structured play interventions also support cognitive processing by helping children understand sequences and expectations during treatment. The review highlights that play therapy improves not only emotional well-being, but also physiological outcomes such as reduced pain perception, which is seen with children that were allowed to game, and better procedural compliance. Furthermore, play fosters communication between children, families, and healthcare providers, promoting more positive hospital experiences. This evidence reinforces the importance of integrating trained child life specialists into pediatric care teams. By applying developmentally appropriate and evidence-based play strategies, specialists help mitigate the psychological stress of hospitalization and contribute to improved health outcomes across age groups and medical conditions. The systematic review and meta-analysis by Martin Villena and colleagues provides compelling evidence supporting play therapy for children undergoing cancer treatment. Children with cancer faced repeated invasive procedures, long hospital stays, and emotional distress related to uncertainty and physical discomfort. Play therapy offers a critical coping mechanism. The meta-analysis shows significant improvements in emotional well-being, reduced procedural anxiety, and enhanced resilience among children who took part in structured play interventions. These interventions include therapeutic storytelling, expressive play, medical role play, and creative arts activities tailored to treatment stages and energy levels. Play therapy also strengthens communication between children and caregivers, helping families navigate complex medical decisions and emotional challenges. Importantly, the review found measurable improvements in treatment adherence, as children who better understood their procedures through play showed increased cooperation. Enhanced mood and social engagement were also seen, contributing to better overall quality of life. These findings underscore the critical role of play therapy in pediatric oncology and affirm its status as an evidence-based part of child life services in comprehensive cancer care. The video from Niswonger Children's Hospital illustrates real-world applications of child life therapy and highlights the diverse responsibilities of child life specialists. In a typical day, specialists prepare children for procedures using developmentally appropriate language, visual aids, and medical play. They evaluate each child's emotional state, coping style, and developmental needs before designing individualized interventions. Specialists often go with medical teams during procedures, offering distraction techniques, guided breathing, and a comforting presence to reduce stress. This video also shows the importance of family collaboration. Specialists educate caregivers on coping strategies, communication techniques, and ways to support their child's emotional needs. Playrooms and bedside activities provide outlets for expression, normalcy, and socialization. The specialist's role extends beyond distraction. They promote therapeutic play that helps children process fears, make sense of medical experiences, and develop coping resilience. This case example highlights how child life therapy integrates theoretical knowledge with practical skill to create empathetic, developmentally attuned, and emotionally supportive care environments for children navigating the challenges of hospitalization. Ramirez's work on the intersubjective nature of play emphasizes the relational processes that occur during therapeutic play. Intersubjectivity refers to the shared emotional understanding that emerges between a child and therapist during play interactions. According to Ramirez, play development is not only an individual cognitive or symbolic activity, but also a co-created relational experience in which the therapist attunes to the child's emotional signals. This relational mirroring allows children to feel seen and understood, strengthening their capacity for emotional regulation and secure attachment. Within child psychoanalytic psychotherapy, intersubjective play supports the development of self-concept, empathy, and social understanding. For child life specialists, this perspective highlights the importance of emotional presence and responsive communication during therapeutic play sessions. Even when interventions focus on procedural preparation or coping, the relational dimension stays central to helping children feel secure. Intersubjectivity enhances the effectiveness of therapeutic play by fostering trust, validating emotional experiences, and allowing children to explore difficult feelings within a safe and attuned therapeutic relationship. Child Life Services extends beyond hospitals, influencing educational settings as well. According to Ross Burrows' work on child life interventions in the school system, child life specialists play an important role in supporting children returning to school after medical events, chronic illness, or traumatic experiences. School reintegration often carries emotional and social challenges, including anxiety, academic concern, and peer relationship difficulties. Child life interventions help bridge communication between families, medical teams, and educators to create supportive plans for reentry. Specialists may offer classroom presentations to explain medical conditions in child-friendly language, reducing stigma, and promoting empathy among peers. Therapeutic play and expressive activities can be integrated into school environments to help children process their experiences and keep developmental continuity. Ross Burrow emphasizes that child life interventions in educational contexts improve emotional adjustment, enhance peer understanding, and promote smoother transitions back to academic routines. The expansion of child life practice highlights the versatility and broad applicability of therapeutic play principles beyond medical environments. Child life therapy is a unique integration of theoretical traditions, psychoanalytic concepts of symbolic expression, developmental insights into cognition and psychosocial growth, and humanistic principles that emphasize empathy and empowerment. Psychoanalytic traditions provide a lens for understanding emotional communication through play, helping specialists recognize themes, fears, and internal conflicts expressed symbolically. Developmental psychology ensures that interventions are tailored to the child's cognitive and emotional capacities, enhancing effectiveness and supporting healthy progression. Humanistic frameworks contribute to the relational core of child life therapy, emphasizing trust, autonomy, and emotional safety. Together, these perspectives create a flexible, holistic approach to therapeutic play that meets children's needs across a wide range of medical and educational contexts. Contemporary research further confirms the effectiveness of this integrated model, showing improvements in emotional well-being, coping skills, procedural compliance, and family adjustment. By synthesizing these theories, child life therapy stays adaptable and evidence-based, offering comprehensive support to children experiencing stress, illness, or trauma. In conclusion, the importance of child life therapy today. Child life therapy plays a vital role in modern pediatric care, educational settings, and broader child well-being initiatives. By integrating theories of play, development, psychoanalysis, and humanistic psychology, child life specialists provide children with tools to process emotions, build coping skills, and navigate stressful experiences with resilience. From the historical roots in the work of Anna Freud and Melanie Klein to contemporary evidence from systematic reviews and clinical practice, a strong body of research proves the effectiveness of therapeutic play in reducing anxiety, improving emotional expression, and supporting developmental continuity. Child life specialists serve as advocates for children's psychological needs within complex medical systems, ensuring that care is compassionate, developmentally appropriate, and child-centered. As healthcare environments grow increasingly sophisticated and potentially overwhelming for young patients, child life therapy is still essential for promoting emotional safety, reducing trauma, and enhancing overall quality of care. The ongoing integration of research, theory, and practice ensures that child life therapy continues to evolve and support children's well-being in meaningful and impactful ways.